Yeah. Good day to everyone. Johnny Balmeyo here, your CI for this subject, health assessment, lecture and skills. So today we're going to have a little discussion about assessment of the thorax and then the lungs. And at the same time, I'm going to demonstrate to you how to perform this one. So first of all, we need to prepare all the equipment that we're going to use. Since this is a physical assessment, okay, it involves 4 techniques. Those are the inspection, palpation, percussion, and auscultation. Siyempre, if we're going to use auscultation, we're going to require a stethoscope. So ito yung stethoscope na ginagamit ko. As you can see, diaphragm lang ang meron siya, wala siyang bell. Okay, so we have another stethoscope right over there. Yun, meron siyang bell, pero mas gusto ko kasi ginagamit to. Okay, this one is mine. So, yeah, stethoscope, and then what else? Definitely, you're going to use an alcohol for the hand washing. Okay, pero prior to performing this one, talagang we really need to perform hand washing prior to and after this procedure. What else? For the efficiency, okay, the nurse usually assesses the posterior of the thorax and then late po yung anterior. Kung mapapansin nyo rin, there are some other practitioners or healthcare provider kung saan likod lang yung na-assess nila. Okay, they omitted yung harapan. Sometimes it really happen and sometimes it depends kung ano ba yung hinahanap mo. Okay, sometimes naman kasi they already have the data regarding doon sa may harapan ng pasyente kaya minsan inuumit na nila yan. And there are also some kung saan auscultation lamang yung ginagawa nila. There are some doctors na ginagawa rin po yun. Okay, darating sila sa may pasyente, okay, tapos ino-auscultate lamang nila yung likod ng pasyente and that's it. They do not perform inspection, palpation, percussion, kundi auscultation lang. Why? Because they already knew the case of their client. They're just doing the auscultation to check for the, what do you call this one, progress, pwedeng nung sakit or pwede rin naman yung treatment ay binibigay natin doon sa may pasyente. Okay, so what else? We need to provide the privacy to our client, of course, lalo na kung babae yan. Always remember na ina-expose lang natin dito is what? Okay, yung area kung saan i-assess natin. Kung i-assess mo lang is yung likod, yun lang expose mo. Huwag mo paghubarin yung pasyente. Okay? Huwag mo paghubarin lahat yan. Or kung paghubarin naman, katulad nito, si Mang Jerry rito, actually nakahubad siya, pero nakadrape yung harapan niya at naka-expose lang dito is yung kanyang likuran. Okay, so what else? We also need to determine for family illness or history ng illness, katulad ng baka naman sa family nila, there is this what we call the cancer. Okay? Or baka naman merong allergic reaction ng pasyente natin, or tuberculosis. Okay? Ang tuberculosis nakakahawa yan, alam naman natin. Okay? So we need to check also for that. Okay? Family history. Ano pa? We also have to check for the lifestyle. Okay? Katulad ng paninigarilyo. Baka ang pasyente natin is chain smoker. Talaga magkakaroon ng problema yan sa may lungs. Okay? Ito yung papa ko, madalas umuubo. Why? Because he is a smoker. Okay? I'm not denying it. Ang dami naninigarilyo. Iba rin, nagbe-vape. And then later on, what happened? Nagkakaroon ng sakit sa may baga. Okay? So what else? Baka dun din sa may trabaho, na sa mga nagtatrabaho sa mga lugar kung saan mayroong mga hazardous materials, those hazardous materials can actually trigger something or it can cause problem to the lungs. Kapag naging discussion natin last time about the bronchitis. Okay, what else? We also have to determine for the medications that our client is currently receiving. Because there are certain medications that may really affect the, what do you call this one? The lung sounds or the lungs itself. Okay, so after the determination, after the assessment, we will now move on to implementations. So as I have mentioned to you kanina, okay, 4 techniques ang gagamitin natin, inspection, palpation, percussion, and auscultation. Unahin natin si inspection. So, ang inspection, we will only use our eyes. Inspection is also known as the observation. So we need to inspect for the shape, symmetry of the thorax from posterior, okay, lateral views, and also anteriorly. We have to compare yung sizes na to kung sila ba ay appropriate. Okay, what I mean to that is, wala bang malaki, wala bang maliit? Okay, symmetrical ba? Baka naman may malaki X yung left, okay, tapos malaki yung right. There was a problem with that. Okay, meron din naman mga cases yung tinatawag nating barrel chest kung saan yung lungs, yung chest talaga is ang laki. Okay, na-discuss naman yan sa inyo during the lecture and alam naman natin what the barrel chest looks like. Okay, ano pa? Pwede rin tayo makakita dyan na sobrang payat, kitang-kita na yung mga intercostal spaces. Possible na makita rin natin yun. Okay, so what else? We also need to observe for the spinal, what do you call this one? The alignment of the backbone. Okay, paano natin ginagawa yun? Okay, we actually ask our client. Okay, we ask our client to stand up. And then we will observe yung likuran nila and then also the lateral position. Okay, pero kung ang pasyente po natin is hindi kayang tumayo katulad nato kay Mang Jerry, kaya ang patayuin nato, hayaan lang natin sila in a sitting position because in a sitting position, kaya naman natin i-observe Kaya natin i-observe if he or she has a problem dun sa kanyang likuran. Katulad nato, i-check mo ngayon, by doing the inspection, i-check mo, okay, proper ba ang alignment ng katawan ni Mang Jerry, ng pasyente po natin? Okay ba ang alignment? Wala bang curvature katulad ng leaning forward? Kasi mayroong mga cases na ganyan, ano? Yung ibang client, for example, ako, yung ibang client kaganyan. Ang tawag nila dyan, yung Tagalog. Ang tawag na natin dyan, yung Tagalog, we call it, naka ganon, parang pakuba. Pinadiretso mo na nakaganyan pa din. Nakalimutan ko yung Tagalog in medical term, we call it kyphosis. We call it kyphosis. Slightly leaning forward, nakaganyan. Bakit? Yung backbone is mayroong problema. Yung iba naman, masyadong nakaliyad na ganyan. We call it lordosis. And then, i-check din natin yung alignment dun sa likuran nila, dun sa may backbone. I-check natin from cervical, thoracic, to the lumbar. Okay? Baka naman meron diyang curvature. If there is a presence of curvature, most probably, anong problema ng pasyente natin? Meron siyang, scoliosis. Okay? So, isa rin yung sa check natin. Okay, what else? So, aside from the backbone, we also have to do what? The stance, yung kanyang manner ng pagtayo. Okay, yung kanyang pagtayo, check din natin. Pero kung pasyente talaga cannot stand, tapos nakaupo lang, hindi natin patayuin. Okay? So, after those things, after inspection, we will now move on to the palpation. So, ano ba yung kailangan natin i-palpate dito? As I mentioned to you guys kanina, okay, for the efficiency and also sa ikagaganda ng assessment natin, uunahin po natin ang back ng pasyente natin, in the posterior thorax. Okay? To those client who have no problem talaga, wala silang complaint sa kanilang chest, okay, we can perform a rapid or a fast assessment. Okay, paano yan? Okay, rapidly assess the temperature and then also the integrity of the chest skin. Check natin. Kaya hawakan natin yung likuran. Okay, mainit ba? Usually warm to touch yan, pero kung yan is hot, malamang may sakit ang pasyente, mayroong lagnat yan. Okay, then hawakan natin, mabilisan lang. Kasi wala namang problema ang pasyente. Wala rin siyang dinadaing. So, pwedeng mabilisan lang gagawin natin. But for a client who has actually a respiratory distress or respiratory complaint, we have to palpate all the thorax. Okay, lahat ng area. For what? For the tenderness, meron bang pamamagayan? For the bulges, ano pa? Some abnormal movement, or baka naman merong absence dyan ng sounds, or different kinds of sounds. Okay, all those things, kailangan nating alamin. Okay, in doing that, we have to palpate the posterior thorax for, what do you call this one? First of all, we have to palpate the posterior thorax for, ano hinahanap natin dito? We are actually looking for the respiratory excursion o yung tinatawag na, tawag dito, thoracic, I forgot the term, the thoracic expansion. Yeah, the thoracic expansion. Okay, also known as the respiratory excursion. Okay, to simplify that, pag sinabi natin respiratory excursion, ito yung pag-expand ng chest or pag-expand ng thorax. Okay, bakit nag-expand yan? Simply because ang pasyente mo is humihinga. Pag huminga yan, if the client breathes in, definitely, lalaki, magkakaroon ng respiratory excursion or also known as thoracic expansion. So, paano ba natin magagawa yun or paano ginagawa yun? Okay, just a minute, papakita ko sa inyo. Okay, so we're going to palpate now the posterior thorax of our client. By doing that, we will put both of our hands dun sa may lower part ng thorax, okay, ng kanyang likuran, okay, posterior thorax. Gawin sa may baba. So you might gonna ask, sir, bakit po gawing ibaba? Because nandoon yung, what do you call this one? Yung base ng lungs, okay? So paano po ba nilalagay yan? Both of our hands should be placed here, okay? I hope nakikita ninyo. Ito yung backbone ng pasyente natin, and then dito natin lalagay both of our hands. And then, yung dalawang daliri, both of the thumb is medyo malapit sa isa't isa. Nasa may gilid ng backbone. Okay? Lagay natin na ganyan. And then we will ask our client to do what? Okay? To inhale and exhale. Okay. Sir, can you please perform deep breathing? Okay. So pag huminga ang pasyente natin, pag huminga yan, sabi nga sa inyo, okay, we are looking for the thoracic expansion or the respiratory excursion. So pag huminga ang pasyente natin, itong dalawang thumb na to, maghihiwalay. Okay, maghihiwalay. Bakit? Kasi nagkakaroon ng lung expansion. Okay? Again, okay, in doing that, lagay natin yung kamay natin dito and ask our client, "Sir, can you please breathe in?" Pag huminga po yan, okay, yung thumb natin medyo maghihiwalay ng konti, about 3 centimeters lang naman yun. Hindi naman sobrang laki, no? Okay, maghihiwalay itong dalawa na to because nagkakaroon ng, what do you call this one? Expansion, okay, yung lungs ng pasyente natin. As you guys can see, okay, yung likod lang na naka-expose dito sa may pasyente natin. Kaya ang expose lang natin is yung part kung saan yun ang i-assess natin. Okay, next one, we will now palpate the thorax for the what we call the vocal fremitus or also known as the tactile fremitus. So paano ba ginagawa yon? Simple lang din. Okay, di ba nakalagay na yung kamay natin dito? Okay, tapos positive yung pasyente natin. Positive for the respiratory excursion. Okay, Kuya, sir, can you please breathe in? Huminga ang pasyente. Okay, sige lang, tuloy-tuloy. So nakita na natin na nagkakaroon ng lung expansion. So that's a good one. That's a good indication that the respiratory system of our client is working properly. Next. Okay, next one, pakiramdaman ninyong mabuti. Now, sir, can you please say blue moon? Okay, so i-repeat ng pasyente yan, paulit-ulit. Blue moon. Blue moon. Or kaya naman, you can ask your client to count 1 to 3. Repeatedly, paulit-ulit. Can you please count, sir? 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so habang ang pasyente natin is nagsasalita, okay, may mararamdaman ka rito. That is is like vibration. Okay, may mararamdaman ka doon sa kamay mo na vibration. That is what we call what? Tactile fremitus or the vocal fremitus. Merong konting vibration. Okay, may konting vibration na mararamdaman ka. Now, paano natin masasabi na what do you call this one? Abnormal ang tactile fremitus. Kung wala kang nararamdaman, tapos ang pasyente natin, nagka-count siya 1, 2, 3, 1, 2, 3, tapos wala kang nararamdaman na vibration, that is the problem. Most probably, your client has what? Okay, pwedeng meron niyang pleural effusion. Or kung sakasakali naman, malakas yung tactile fremitus na naririnig mo, okay, baka ang pasyente natin is merong pneumonia. Okay, in some other books, they suggest na kapag nakalagay dito yung kamay mo, okay, that one will be enough. While some other books, they suggest, check mo din yung iba pang part ng lungs niya or iba pang part ng thorax. For example, here, okay, pakiramdaman mo rin dito yung tactile fremitus. Can you please count 1, 2, 3, sir? Sige, go on lang. 1, 2, 3. 1, 2, 3. Okay, isa pa. Count 1, 2, 3. 1, 2, 3. 1, 2, 3. And then baba ka. Hanggang makaabot ka dito sa may base, okay, ng lungs. Okay, dito yung base ng lungs. Okay, go on. Continue. 1, 2, 3. 1, 2, 3. Isa pa sa chine-check natin is the symmetry. Kailangan, kung may nararamdaman dito sa may left, na tactile fremitus, dapat meron ka rin maramdaman dito sa may right. Hindi po pwede na isa lang yung part na merong tactile fremitus. Kung dito merong tactile fremitus at dito wala, wala ka naramdaman na vibration dito sa may left part. Okay, delikado yun. Okay? Baka andito yung pleural effusion. Or worse, baka marami pa siyang ibang problema sa kanyang lungs. Or kaya naman, andito lamang yung malakas na vibration, dito normal. So malamang meron tayong pneumonia rito. Okay, possible ba mangyari yun? Yes, it's possible. Okay, kaya nga dalawang kamay ang ginagamit natin para ma-compare natin both sides, the left and then the right. Okay, so after the palpation, we will now move on to the percussion. Okay, na-discuss naman na sa lecture ninyo itong percussion and also how to perform the percussion. Okay, saglit lang. Okay, so after the inspection, palpation, we will now move on to the percussion. Isa po nga sa inyo, ang flow na sinusunod natin in this physical assessment is IPPA, inspection, palpation, and then percussion, last yung auscultation natin. Okay, so ano ba yung percussion na yan? Okay, percussion is actually an art. Art talaga. No? This is actually a procedure where we tap different body parts to produce a sound. Okay, ang sound na napoproduce usually is resonance or hyperresonance o pwede rin naman na dullness. So, okay, paano ba nagiging resonance yan? Or ano ba ang resonance? Okay, ano ba yung sound niyan? Okay, it's like percussing a hollow organ. Okay, for example, ito, hollow kasi ito, andito yung hingahan ni Mang Jerry. Okay, so pag pre-percuss natin to, ganito yung sound na mapoproduce. As you can see, malakas. That is actually a hyperresonance. Bakit? Kasi empty tong likuran ni Mang Jerry. Okay? Pero sa mga normal na tao, hindi naman ganun kalakas ang maririnig ninyo. Okay? Almost the same. Okay? Although, ito nga lang talaga, since this is a mannequin, kaya ganyan yung naririnig natin. For the dullness naman, Yung dullness naman, ito yung nagpe-percuss ka sa isang bagay na mayroong laman sa loob. Kaya minsan, ang napoproduce na sound is mahinang-mahina lang. For example, you are percussing, what do you call this one? Okay, ito leg ko. Let's say for example, ito lang ha. So wala halos na po-produce na sound. Bakit nga? Flesh yung pine-percuss mo. Okay? So what else? So paano ba ang percussion? Paano ginagawa rito? Okay, let me just show it to you guys. In doing the percussion, ilatag mo yung kamay mo na ganyan. Okay, ihiwa-hiwalay mo. Pero ang gagamitin lang natin in the percussion is your middle finger. Kaya ito lamang ang gagamitin natin, your middle finger. Okay? So your middle finger, and then itatap mo itong middle finger na to using your middle finger rin. So meaning to say, dalawang finger ang gagamitin natin, guys. Okay? So dalawang middle finger ang gagamitin natin. Okay, so may nakalagay dito sa may parts ng katawan ng pasyente, sa may skin. Eh, medyo idiin mo, ano. Kasi kung mababaw lang, nakaganyan lang yung kamay mo, it will not produce a good sounds. Kasi yan yung nangyayari sa mga student namin last time. Kaya mga nagre-return demo na mga student namin, okay, pagka pinagpa-percuss ko, wala kami naririnig na sound. So bakit ako gano'n walang naririnig? Not unless may problema yung pasyente ninyo. Okay, sabi ko rin sa may student, doon pala ang nangyayari is hindi nila masyadong idinidiin ng konti. Okay, idiin mo ng konti. Okay? So pag diniin mo ng konti na ganyan, using your other other hands, and then the other middle finger, okay, dito itap mo. Okay, sa mo yung itatap dito sa may part na to, ano? Okay, dito mo itatap, dito. Okay, again, idiin mo ng konti itong kamay mo. Okay, tapos ito, dyan ka magtatap ngayon. Okay? Okay, 1, 2, 1, 2. Okay. Ako naman, ang technique na ginagawa ko dito para mas malakas yung sound na ma-produce, instead of using only one finger, okay, I use two fingers. My middle and also my index finger. Okay, so dalawa. Para mas madali nating ma-assess yung sound na napoproduce sa may percussion. Okay? So let's now move on in percussing our client, the thorax of our client. We will ask our client to, slightly bend the head forward. And then katulad na sabi ko sa inyo during our lecture, kapag ina-assess natin yung likuran, especially if you're going to do percussion and auscultation, ask your client to do this one. Okay? The opposite hand, okay? This hand will be placed to the opposite upper extremity sa may shoulder, and then the other one. And then, okay, grab niya to, tapos hila forward. Nang sa ganun, yung scapula is ma-expand mo, and then forward. So, mas na-expand yung posterior thorax. Okay, mas maganda yung mapoproduce natin na assessment, or should I say, the percussion. Okay, so, pasensya na, hindi magagawa ni Mang Jerry yun, kasi si Mang Jerry wala namang, what do you call this one? Skeleton. Okay, so yan, si Mang Jerry nakatalikod. Okay, so, what else? So, slightly forward, nakahawak dun sa may dalawang shoulder. What else? Ang ipe-percuss po natin dito, pakitandaan lang, it should be the intercostal spaces or the interspaces. Okay, yun ang pinapercuss natin. Okay, sinabi ko naman sa inyo last time, di ba, yung different places. Okay, we have the ribs, the interspaces. Okay, sa may pagitan ng dalawang ribs, for example, ito yung ribs. Sa may pagitan yan, andun yung interspaces, doon natin ilalagay yung finger natin, yung middle finger. Okay, doon natin ilalagay. Next one, we will now compare both sides kapag ka nag-percuss tayo. Nag-percuss ka dito, nag-percuss ka dito. Hindi mo pwedeng dito ka lang mag-percuss. Dapat i-percuss mo rin dito sa may other parts. Okay, bakit? Siyempre, dalawa lungs mo. Okay, what else? You have to percuss the lateral thorax every few inches. Okay, starting at the axilla, okay, and then working down to the 8 ribs. Para mas madali ninyong malaman kung saan tayo mag-percuss, okay, there are actually 10 spots. Okay, 10 spots sa may likuran kung saan tayo magpe-percuss. Dito, dito. Okay, so may taas 1, 2, next baba ka dito, 3, 4, 5, 6, 7, 8, 9, 10. Okay, as you can see, okay, parang siyang snake line na dire-diretso, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pababa tayo. Sir, bakit po gano'n? Bakit pababa? Kasi mag-start tayo from apex going to the base of your lungs. Okay, kaya gano'n ang ginagawa natin. Excuse me. Okay, next. Okay, I'm going to perform now the percussion of the lungs, okay, or the thorax. Okay, middle finger to middle finger. I'm going to use my 2 fingers. Okay, going taas. Okay, this is the apex of the lungs. Okay, as you can see, medyo ibang sound na napoproduce dito. Okay, kumpara dito. Okay, bakit? Kaya actually, si Mang Jerry rito, meron siya kasing machine sa may loob. Okay, kaya iba yung napoproduce. As you guys can see, okay, or heard, iba yung napoproduce na sound. Kapag meron tayong pasyente na ganyan, iba yung sound na napoproduce dito. Okay, we have to double check that and then i-report natin. Kasi malamang sa malamang may problema ang pasyente natin. Kaya magkaiba yung sound nung magkaibang part. Okay, as you can see, ayun o. Unlike dito, okay, dito resonance. Pagdating dito, medyo bumababa. Okay, there's a problem with that. Okay, and then we really have to refer that. Okay, so that's it. That's how you percuss. Ganun lamang po kadali. And remember, kung ano lamang yung kailangan mong i-assess, yun lamang dapat ang i-open. Then sa may harapan, it should be covered. Okay, what else? So after percussion, ano ba yung kailangan natin? Okay, na matutunan dito sa may percussion. Okay, hindi lamang likod ang pinapercuss, definitely pati harapan po. Ano? So after percussion, we will now move on to the auscultation. Pakitandaan lang din na yung mga points kung saan tayo magka-percuss, doon din po tayo mag-auscultate. So here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, 10 spots. Okay? Pero sir, bakit po ganun? Yung iba pong doktor na nakikita namin. Ilang spots lang? 4 lang usually. Okay, 5 pa nga minsan. Because those doctor, they already knew okay, what's happening to the client. And then alam din nila na ang apektado rin sa may pasyente, po pwedeng left lang, po pwedeng right lang. Okay, they already knew. Okay? We as a healthcare provider, mga nurses tayo na nag-a-assess din naman tayo ng progress. Okay, kung meron ba nangyayari, o pwede rin naman the development of the disease, po pwede rin natin i-assess yan. Okay, kailangan kompleto tayo. I-kompletohin natin from here pababa. Okay, the 10 spots. Okay, so after the percussion, we will now move on to the auscultations. So when you say auscultation, we're going to use this one, okay, the stethoscope. Okay, so when you say auscultation, actually, when you say auscultation, already discussed it during the lecture naman. Okay, kung kanina, we tap our finger to produce sound. This time naman, we're going to listen, okay, to the body that produces sound, and that is lungs. Okay, in doing the auscultation of the thorax, we will actually use, saglit lang. Anong gagamitin natin dito? Is it the bell or the diaphragm? Anong gagamitin natin? Okay? Ito kasing stethoscope ko, meron lang dito diaphragm. Okay? So, anong gagamitin natin for this procedure? Okay, auscultation of the thorax. Anong gagamitin natin? Is it the bell or the diaphragm? Okay? Ano sinabi ko sa inyo last time? If you're going to listen to the low-pitch sound, okay, you're going to use what? The bell. Okay, but if you're going to listen to the high-pitched sound, okay, you're going to use the diaphragm. Okay, so here, since diaphragm lang meron ako, okay, saktong-sakto, pang lungs to. Okay, so I'm going to use the diaphragm here of my stethoscope. Okay, saan po ako maglalagay dito? And before that, we need to use the systematic zigzag procedure katulad nung pinakita ko sa inyo kanina, dun sa may pagpa-percuss. So kung saan ka nag-percuss, doon ka rin mag-auscultate. So ask your client to take a slow, deep breaths through the mouth. Okay, and then listen, pakinggan natin for every inhalation and then exhalation. Then, katulad din doon sa may percussion, we have to compare, okay? We have to compare both sides. Kumpara natin ano yung napoproduce na sound dito, dito. Okay? Okay, paano yan? Let me show you. Saglit nga lang. Esensya na at mag-isa na naman ako dito eh. Yeah. Okay. Okay, in doing that, okay, we will try to listen from here to here hanggang sa makababa tayo. And then we will ask our client to breathe in and out normally, yung normal lang na paghinga. Okay? So sige, sir, can you please breathe normally? I will just try to listen to your lung sound. Okay, hinga malalim. Okay, go ahead. Okay, thank you. Okay, that's it guys. So papakinggan nyo kung saan ka nag-percuss kanina. Okay, kung saan ka nag-percuss nung ka rin mag-auscultate. Okay? So ano ba yung mga sounds na pwede natin marinig? First of all, alamin natin what is the normal breathing. May paparinig ako sa inyo, no? Saglit lang. Si Mang Jerry actually, he can produce a different lung sounds. Okay, unfortunately, hindi ko makita yung stethoscope niya eh. Kaya may sarili kasing stethoscope to. Ganon din kay Junoy, nasa baba, it produces different sounds. Pero meron akong paparinig sa inyo because we have here a speaker that can produce lung sounds. Kaya may paparinig ako sa inyo. First of all, alamin niyo ano ba yung normal na lung sounds? Okay? What is the normal lung sounds? Ito po. Okay, so that is what we call the bronchial sounds. Okay, there are actually different normal sounds. Okay, we have bronchial, broncho-vesicular, and we also have vesicular. Pero meron din yung isa, yung natawag ng tracheal. Okay, pero sa mother books kasi, they only suggest 3 normal sounds. We have the bronchial, the vesicular, and then broncho-vesicular. Okay, yung tatlo po na yun. Okay, yung pinarinig ko sa inyo, that is the normal breath sounds. Now, let's try to look for other abnormal breath sounds. Ano-ano pa ba yung mga ibang abnormal breath sounds? Okay, katulad na to. This is crackles. Okay, as you guys can hear, crackles, parang may nagka-crack. Okay, from the word itself, crackles. Parang may nagka-crack inside the lungs. Okay, may mga naglalagutukan. Okay, gawin yung sound na marinig ninyo sa may crackles. Okay, don't worry, I will make a separate video. Okay, para kung narinig din nyo kayo, marinig nyo dun sa may another video, sa may discussion ko. Okay, there's the crackles. Next, we have the diminished breath sounds. Nawawala. Breathe in. Biglang mawawala kapag mag-breathe out na. Okay, merong inhalation. Biglang mawawala kapag exhalation. Okay? Next one, we call it the expiratory wheezing. That is what we call the expiratory wheezing. Okay, expiratory wheezing, usually maririnig niyo to sa may asthma. Bakit? Nagkakaroon kasi ng constriction dun sa may labasan ng hangin. Okay? Sa may wheezing, it sounds like sumisipol. Sa may expiration, dun yung maririnig pagka may wheezing. Parang sumisipol. And sometimes, para siyang what? Parang it produces letter Z, kaya siya tinawag na wheezing. Okay? It sounds like it produces Z sound. Okay? So usually maririnig po ninyo yan sa may mga pasyente na merong asthma. Next one, okay, this is what we call the pleural rub. Paano natin masasabi na pleural rub to? Simple lang. Okay? Hawakan mo yung buhok mo. Okay? Tapos i-rub mo. Ganun yung sound na napoproduce ng pleural rub. Okay? Hawakan mo yung mga buhok mo and then kiss-kiss mo. Okay? gano'n na po-produce sa may pleural rub. Okay? Parang nagkikiskisang buhok. That is the sound being produced by the pleural rub. Okay, next one, this is what we call the bronchi. Pakinggan natin. Saan natin may kukumpara tong sound na to? Parang naghihilik, parang nag-snore. Eh, ganun yung narinig natin sa may bronchi, para siya nag-snore. Next one. This is what we call the stridor. Ang ingay, di ba? Eh, ang stridor, para rin siyang wheezing. Eh, usually narinig nyo to sa may mga pasyente na merong sipon. Eh, may nagpipiti, parang may nagpipiti, lalago, mga what do you call this one? Nagpipitikan? Pitikan ba yun? Lalagutukan. Okay, ng mga plema sa loob ng lungs. Okay, so that is the stridor. Okay. Next one is we have the visicular breath sound. Ang visicular breath sound, normal din to, no? Pakinggan lang natin, ha? Okay. So those are the different sounds na pwede nating marinig kapag nag-auscultate tayo sa may pasyente natin. Okay, so there are those normal and abnormal. Don't worry guys, I will make a separate...
Hi Meg!
Sorry. Okay, I will make a separate video for the further lung assessment. Okay, so after that, okay, we're through. Okay, tapos na po tayo dun sa may posterior thorax. We'll now move on to the anterior thorax. So kung kanina nag-inspect tayo rito, nag-palpate, okay, nag-percuss, nag-auscultate sa may likuran ng pasyente, okay, sa may harapan, gagawin din po natin yun. Okay, we're going to do that too. What else? Sabi nga sa inyo during our lecture, okay, magandang ina-assess yung anterior thorax kapag ang pasyente natin nakahiga. Pero kung ang pasyente natin nakaupo na, hayaan na natin. Okay, we do not have to ask them na humiga ka pala, nakamatanda yan. Tapos okay naman sa kanya na nakaupo. Okay, kung yan, papahigain mo, papaupuin, patatayuin, it is just a burden para sa kanila. Okay, so kung nakaupo na yan, at the same time, we can perform further assessment. Okay, after here, we will now move on dun sa may harapan. Kaya ano sabi ko sa inyo kanina, yung mga part lang na i-assess natin, ang i-expose natin. So kung dito naka-open tayo, now ipo-close na natin to, and syempre, ang bubuksan natin is yung harapan. Okay? So okay, after the posterior thorax, we'll now move on to the anterior thorax. Okay, as you can see, okay, ang naka-expose lang dito is yung harapan. Of course, naka-drape yung likuran. Okay, sana all may dede, ano? Si Jerry naman, kalalaking tao, may dede. Okay, anyway, so we have here now the anterior thorax. So, katulad ng ginawa rin natin doon sa may posterior thorax, we're going to do it here also sa may anterior. So, we will inspect the anterior thorax. We're going also to inspect for the breathing pattern, okay, the respiratory rate, and also the rhythm. Okay, we're going also to inspect for the costal angle. Okay, ano ba yung costal angle na yan? Although it's not really that important, and then minsan nga nakakalimutan ng gawin ito. Yung costal angle na yan is nandito. Okay? Okay, that is actually, when you say costal angle, that is actually the angle formed by the intersection ng coastal regions, or should I say coastal margins. Okay, tama, coastal margins. Okay, dapat daw this one is what? Okay, 90 degrees ito. Okay, so may diaphragm going to the xiphoid process. Okay, it should be less than 90 degree. Kapag yan umabot more than 90 degrees, kaya ang problema niyan is nagkakaroon na expansion yung lungs ng pasyente natin. Usually makikita niyo yan sa mga merong barrel chest, kung saan lumalaki yung kanilang chest. Okay, so after that, we're going to palpate also, okay, the anterior thorax. In palpating it, okay, 10 spots din, yan, tama. 10 spots din ang pagpapalpate dito. Kaya ang pinapalpate natin, ang 10 spots, yeah, 10 spots. So we're going to palpate here, okay, supraclavicular. We're going to palpate here, okay, palpate here, here, and last here. Okay, those are the areas na pinapalpate natin. Or we can also perform yung palpation kanina sa may likuran ng pasyente, in which we're going to place our hands, okay, our palm dito sa may pasyente natin. Okay? And then we're going to check for the lung expansion. Okay, parang yung kanina lang din. Okay, we check for the, what do you call this one? The respiratory excursion of our client. Okay, respiratory excursion. So, paano ginagawa? We place our palm or our hands like this. And then, as you can see, meron ditong pagitan. Okay, medyo magkahiwalay ang kamay. And then, hirap magpigil ang tawan pa yan. Okay. And then, we will ask our client to breathe in and out. And then, pagka nag-breathe in po yan, syempre, magkakaroon ng malakas na or paglaki ng chest niya. So, mangyayari is yung thumb medyo maghihiwalay. Okay? Medyo maghihiwalay yan. Okay? Why? Because there is a lung expansion. Okay? That's how we do it. That's how we palpate. And that's how we look for the respiratory excursion. Okay? And also, we can also palpate the whole chest. Okay? Palpate natin ito. And then baba, 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 hanggang bumaba dito. Okay, yung pinapalpate natin, we actually look for some lesions, okay, any abnormalities dun sa may skin, meron bang pamamaga. Okay, so those are the areas na pinapalpate natin. Okay, we also ask our client, okay, to deep breath, okay, habang i-observe natin yung movements ng kamay natin. What else? We also palpate for the tactile fremitus, yung vocal fremitus. Parang sa may likod lang din yan. Okay, we place our hands here, and then we will ask our client to say blue moon, or kaya naman pa-count natin 1, 2, 3. Okay? Okay. Parang ganito. Mang Jerry naman kasi may dede. Kaya ask our client, sir, can you please count 1, 2, 3? Okay, 1, 2, 3, 1, 2, 3. And then of course, maramdaman natin yung konting vibrations. Parang sa may likod lang din kanina. Okay, what else? So after the palpation, we will now move on to the percussion. So kung kanina there are 10 spots, for the percussion of the anterior thorax, we have 18 spots. Okay, 18 ang spots natin dito. Ano yung mga spot na yan? We have the supraclavicular, sa may taas ng clavicle. Okay, dito tayo mag-start. 1, 2, and then sa may baba, 3, 4. Baba ng clavicle. Then baba tayo, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and then baba rito, 15, 16, and then last, sa may gilid. Okay, andito ako sa may baba, halos baba ito ng nipples, ano? Sa may pinakagilid, 17, 18. Okay, yun yung pinipercuss natin sa may anterior thorax. Okay? So, ano yung sound na mapoproduce natin dito? Usually, ang napoproduce natin dito sa may taas, supraclavicular, is what? What do you call this one? Dull, kay dullness. Bakit? Kasi may muscle dito. Okay, although andito yung apex, hindi mo siya masyado ritong mapepercuss. So, usually, ang sound na napoproduce dito is what? Dullness. Then, pagdating naman natin dito, yan, medyo nagkakaroon na rito ng resonance. And then, pababa. Ikukumpara mo lang din, syempre, of course, yung sound na napoproduce dito, tsaka dito. Okay, well, here's the problem. What if our client is female? Of course, lalo na kapag medyo malaki yung daddy niyan. It's kind of awkward to do that percussion. Okay, it's really awkward to perform that procedure, lalo na lalaki ang healthcare provider, tapos babae ang pasyente natin. That's kind of awkward. That is why the percussion of the anterior thorax is sometimes being omitted. Ino-omit na to. Why? Kasi kung nakapag-percuss ka naman na sa likod, okay, enough na yung data na meron tayo dun sa may likod ng pasyente. Okay, so you do not have to perform, not unless the case told you so. Okay? For example, ang client talaga natin is mayroong malubhang sakit na kailangan talagang i-percuss. Itong anterior thorax, definitely you have to percuss it. Pero kung yung data na kailangan mo is nakuha mo naman na sa likod ng thorax, that one will be enough. I remember I have one student before in a hospital. Okay? Si Doc nawakan yung daddy nung estudyante ko. Okay, nagalit ba ako? Siyempre, hindi ako nagalit. Bakit? Kasi doktor niya talaga yun eh. Okay? So, nalibre yung estudyante ko ng, what do you call this one? Nalibre ng check-up. So, nakita namin yung doktor niya dun sa may hospital na pinag-duty namin. So, sabi ko kay Doc, ito yung dati mong pasyente. Okay? Pa-check nga po kami nung kanyang breast kasi nawala na, tinanggal nyo na dati, Doc, yung cyst, pero bumabalik ulit. So yun, chinek ni Doc. Katulad nun, okay, nagpalpate si Doc dun sa may chest ng pasyente, ng student namin. Kasi kailangan. Okay? Yun yung sinasabi ko sa inyo na kung kinakailangan niya, we have to perform it. Pero kung hindi naman talaga, at enough na yung nakuha natin na data dun sa likod, we have to stick to that. Sa may return demonstration ninyo, ang kailangan nyo lang is yung likuran. Okay? You do not have to show yung harapan ng pasyente natin. Okay? Yung likuran lang, you have to perform there, the IPPA. Okay? That one will be enough. Okay? Enough na yun. Hindi nyo na kailangan gawin pa yung sa may harapan. Okay, what else? I forgot to mention kanina pala about the, what do you call this one? The auscultation. Okay, I forgot to mention about the auscultation na kapag ka nag-auscultate tayo, kailangan diaphragm to the skin talaga. No, hindi po pwedeng diaphragm kasi ito yung damit ng pasyente, nilagay mo dyan. Okay, baka may marinig ka dyan, sabihin mo plural rub. Okay, plural rub yung narinig mo dahil nagkikiskisan itong diaphragm tsaka yung damit. So we do not do that. Okay, kailangan diaphragm or the stethoscope, the diaphragm itself, the stethoscope itself, okay, kailangan it-touches dun sa may skin mismo ng pasyente. Hindi po pwede na andun sa may damit. Okay? There's a possibility na ma-alter yung sound na po-produce. Okay? Or naririnig mo from the diaphragm. Okay? So, yeah. We're done with the percussion. Now, for the auscultation, same lang din yan. Okay? Kung ano yung mga pinarcast mo dito, okay, the 18 spots, dun ka lang din mag-auscultate. But then again, for the auscultation, kung nakuha mo na yung data dun sa may likod ng pasyente natin, okay, meron ka nakita abnormalities doon, that one will be enough. Okay? Ngayon, kung gusto mo talagang verify yung data na nakuha mo dun sa may likod, because there's a really an abnormality, you can perform that dun sa may harapan. Okay? Again, if the case told you so, kung kinakailangan talaga. Okay? So, after the auscultation, okay, again, kailangan skin to diaphragm. So, after the auscultation, we'll now move on to the documentation. So, you really have to document all the findings na nakuha mo, normal man yan or abnormal, okay, document mo, nakalagay yan dun sa may nurse's remark sheet natin. Explain ko naman na sa inyo last time about the different sheets na meron dun sa may chart. Okay, so document mo lahat ng abnormalities. And then, if ever na merong abnormal na kailangan malaman ni doc, then you have to report it. You have to report any deviations dun sa data na nakuha natin to the primary healthcare provider, which is the doctor. Okay, so after the documentation, okay, evaluation, the report na natin, okay, that's it. Okay? Dito mag-e-end or magko-conclude yung ginawa nating, what do you call this one? Chest assessment. Okay? The lung or the thorax assessment. If you guys have some questions, feel free to ask me dun sa may GC natin. Or also, kung next week makakapag-discuss pa tayo, then you can ask me guys. Okay, that concludes our discussion. Cherry naman. Okay, again, if you have some question guys, feel free to ask dun sa may GC natin, okay? And that's it, that concludes our discussion.